Hey, good morning, everybody. It's Congressman Jamie Raskin coming at you from Maryland's beautiful 8th Congressional District. Welcome to our 7th annual Federal Employee Health Benefits Forum. The federal benefits open season for 2024 is November 13th through December 11th. And in prior years, we've held this event at the wonderful Holiday Park Senior Center with all our friends over there. And I look forward to gathering there again in the future with our good friends from Maryland NARFE and the representatives from all the different insurance providers. This presentation will be available on my website at raskin.house.gov. And we, of course, like doing it electronically so people all throughout Maryland's 8th District can check it out. We've got a great panel of experts this year, but before we begin, I wanted to share a few high-level updates with you relating to the federal workforce. I'm proud to represent more than 50,000 federal workers and retirees who live in the 8th. This year, I also became the ranking member of the House Committee on Oversight and Accountability. And in that role, I'm dedicated to countering all the disinformation about our nation's public servants and government employees, ensuring that federal workers and retirees are treated with respect and with solidarity. And I'm fighting to make sure that federal workers get all of the benefits and all of the health insurance that they deserve and have bargained for. President Biden has proposed an average of 5.2% pay raise for federal employees in 2024. And if enacted, this will be the biggest pay raise for federal workers in more than a decade. Let's see. Turning now to retiree COLAs, as I'm sure many of you are well aware, in 2024, there will be a 3.2% COLA cost of living adjustment for federal retirees under the Civil Service Retirement System and a 2.2% increase for federal retirees who are under the Federal Employee Retirement System, or FERS. I'm a co-sponsor and champion of the Equal COLA Act, which would fix this unfair two-tiered system and ensure that FERS retirees receive the same cost of living adjustments as other federal employees are getting. I applaud the president for his ongoing efforts to ensure that all federal workers, including contractors, earn at least $15 an hour. And I appreciate his dedication to creating more good-paying union jobs as his administration continues to implement the bipartisan infrastructure law, the CHIPS and Science Act, and of course, the Inflation Reduction Act. In the year ahead, I will continue to work with the Biden administration to do everything I can do to protect and empower all of our federal workers and retirees. So let's start our forum. We've assembled an amazing group of experts for today's panel who are ready to discuss the various federal employee health benefit plans and other options that are available to you. We are joined by Jay Fritz from the Office of Personnel Management. We're joined by our friend Tammy Flanagan from NARFE, and Walt Francis and Kevin Moss from the Washington Consumers Checkbook, an indispensable local organization. And I'm going to turn it over at this point to my district team. Sarah Lev assists with all health insurance, Medicare, and Social Security matters in my district office, and she's joined by my district chief herself, Kathleen Connor. I know this is going to be a fascinating and very useful discussion for all of you, and I'm wishing you the best as you navigate the different twists and turns of the federal employee health benefits process, something I'm going to have to look at myself. And now I turn it over to Sarah Lev.
Good morning. So we're going to start by welcoming Jay Fritz, who serves as the Program Manager of Outreach and Program Services, OPS at OPM, the Office of Personnel Management. Jay has worked at OPM for over 20 years, including on the FEHB program as a benefits claim examiner, information specialist, and policy and program analyst.
Thank you, Sarah, and Representative Raskin. As Representative Raskin pointed out, the federal benefits open season for the 2024 plan year will be held this year from Monday, November 13th through Monday, December the 11th, which means we're 1 week out from the beginning of open season. Open seasons for health insurance under the Federal Employees Health Benefits Program, dental and vision insurance under the Federal Employees Dental and Vision Insurance Program, also known as FEDVIP, and also for the Federal Flexible Spending Accounts Program under for FSA Feds under the Federal Federal Flexible Spending Account Program, FSA Feds. So federal benefits open season gives federal employees, annuitants, and other eligible individuals the opportunity to review their FEHB and FEDVIP plans. They can make choices to change their plans. They can enroll if not enrolled for one of the FEHB or FEDVIP plan choices for 2024. As in past years, federal employees are encouraged to consider the tax savings available through the FSA Feds program, setting aside the annual amount they're projected to spend in out-of-pocket health, dependent care, dental and vision expenses. A flexible spending account or an FSA saves federal employees money. For example, for a healthcare federal flexible spending account program, an employee can contribute from $100 up to $3,050. So the $100 is kind of the entry level. If someone doesn't really commit to that much money, they can start small with $100. And then for dependent care flexible spending account, they can contribute from $100 up to $5,000 per household. We at OPM do encourage everyone to visit our open season page for open season. Our website is www.opm.gov/open season for all the information we have. We do encourage people, even if you're satisfied with your current plan that you have for 2023, still go take a look. There's a lot of information out there. Benefits will likely change for your FEHB plan, and we're almost certain that premiums will change for 2024 for your FEHB. So we do encourage you to go out and take a look. We do have various information on that website. We have the 2024 FEHB and FEDVIP plan brochures. These are the documents that lay out all the benefits that are provided under each of the plans. We have links to plan websites for additional information, and we have links to plan provider directories. We have FEHB and FEDVIP premiums. If you want to see what your premium is going to be for next year for your current plan, or if you're considering a different plan, you can go see how much the rates will be. We have links to our FEHB and FEDVIP plan comparison tools. And there you can go and enter information on the area where you live based on your zip code, and you can compare several plans as to exactly what those plans provide, help you determine what might be a good plan for you. We also have information on how to enroll. So you've done your research, now you're interested in how to enroll. So we do advise FEHB employees can use our agency-specific enrollment portal or the paper standard form 2809. FEHB annuitants can use open season online. They can do everything electronically. And then for FEDVIP, we want to remind, different from FEHB, all FEDVIP enrollments are handled through the Benefeds website. So it's one central location for FEDVIP. FSA Feds, we have information about that. And OPM really does promote FSA Feds due to the tax saving benefits for federal employees. You can get information on how to enroll, information on how FSA Feds work, and also what are some of the eligible expenses you can claim. One thing we do point out for FSA Feds and flexible spending accounts, they do not carry over from year to year. Your FEHB or FEDVIP enrollment will continue if you do nothing. FSA Feds is different. Employees must enroll every year to take advantage of the tax saving benefits of FSA Feds. And those enrollments are made through FSAFeds.com. And we do also want to point out again, we probably mentioned this a couple of times, only federal employees can participate in the federal flexible spending accounts program. FSA Feds annuitants are not eligible. So now you've done your research, you've decided what you want to make a change, if you're already enrolled or you want to enroll if not enrolled. We told you how to do it. So now when will these changes become effective? So FEDVIP enrollments and enrollment changes are effective on January 1st, 2024. They are always effective on January 1st. FSA Feds enrollments are also effective on January 1st, 2024. FEHB enrollments are a little bit different. They're effective on the first day of the first pay period that begins in January the next year. Annuitants, that will be January 1st, 2024, because annuitants are paid monthly. Most employees, the first day of their pay period in January will be January 14th. Postal employees are a little bit different. Their pay cycle is a day off from most federal employees. Their effective date will be January 14th. Again, because of their pay cycle is different. couple significant events to be aware of for the constituents is the NALC health plan is terminating their value option at the end of 2023. Enrollees who do not change to another plan during open season will be automatically enrolled in the consumer-driven health plan option of NALC for 2024. The Compass Rose Health Plan, now this is one of our closed FEH plan. It's only open to particular groups and annuitants, groups, members, employees, and annuitants. They are adding a standard option for 2024. And Compass Rose is also opening their enrollment to employees and retirees of the Department of Veterans Affairs. So there's a couple new options available there for constituents. So that kind of wraps up the basics of open season. With that, I'll turn it back to Sarah and our next speaker.
Thank you so much. So next we're going to welcome Tammy Flanagan, who serves as a benefits expert for the national, active, and federal and retired federal employees, NARFE. Tammy Flanagan has spent 30 years helping federal employees take charge of their retirement by understanding their benefits, and she provides individual counseling as well as online training for NARFE and Plan Your Retirement and the federal long-term care insurance program. Turning it over to you, Tammy.
Thank you so much, Sarah, and thank you to Congressman Raskin for putting on such an informative program for his constituents, because this time of the year, I know it's true for OPM, it's true for certainly Kevin Moss, and it's true for me. This is such a busy time because people have so many questions about open season. And I get a lot of questions from retirees because a lot of our membership at NARFE are retired federal employees or federal employees who are preparing to retire, and they're facing decisions not only during open season with FEHB and FSA feds and the FedVIT program, but they're also facing Medicare decisions. So I wanted to focus the time that I have today talking about some of the things we have to consider when we turn 65. And federal employees have been paying into Medicare since 1983. So all of us, including our spouses, if we're married, qualify for Medicare Part A at no charge. And I really can think of no reason not to enroll in Medicare Part A when you turn 65, even if you're still employed, with only one exception, and that would be for federal employees who are participating and contributing to a health savings account. And those health savings accounts go hand in hand with a high deductible health plan. And if you're contributing to any other health insurance, including Medicare, you can't contribute to an HSA. So with that exception, otherwise, I think Medicare Part A is going to help out if you get admitted to the hospital. That's really the only time Part A is going to come into play, or if you go into a skilled nursing facility, such as rehab after a bad fall or after a stroke where you need to recover. Medicare Part A, in hand with your federal health plan, will generally cover pretty close to 100%, at least for the first 20 to 30 days of care. Some plans give you more care, maybe 60 days, depending on the plan. But the big question really comes up with Medicare Part B. And we always kind of joke around, to be or not to be, because federal employees are among the only group in the country, really, that can choose not to enroll in Part B, yet they still have health insurance. The federal health plans will still cover them. And that also remains true for the 2024 plan year for our Postal Service employees and retirees as well. That will change to some extent in 2025, but we'll put that aside till next year to talk about. So Medicare Part B, what it does when it's combined with the federal health plan is it pays as your primary payer if you're retired and over 65. And as a result of that, if you look in Section 9 of your federal health plan brochures, you'll see that oftentimes, not every time, but oftentimes one of those plans within that plan family, whether it's Blue Cross Basic within the Blue Cross family, or whether it's Aetna Direct or Aetna Advantage within the Aetna family, one of those plans will really dovetail quite nicely with Medicare A and B, meaning that they're going to waive your deductibles, co-pays, co-insurance, maybe even provide you a rebate of some of that Part B premium so that cost isn't so great. So it ends up that when you go to the doctors, when you need physical therapy, when you have those expensive MRIs or other types of lab testing, you pay nothing out of pocket other than that additional premium for Medicare Part B. That can be a lot of money because for 2024, Medicare Part B is up to $174 and I think it's 60 cents a month per person. So if you're married and your spouse and you are both over 65, that's two of you paying that premium. And for our higher income retirees, we have something called IRMA, the income related monthly adjustment amount, that can significantly increase that premium if you're in the higher income ranges. And only about 7% of all Medicare beneficiaries fall into the IRMA categories. But if you're in it, doesn't matter if it's only 7% or 107%, that's something you have to take into consideration when you're making those decisions. Another thing that's new for next year that's causing a lot of stir is the Medicare Part D prescription drug benefit plans. Many FEHB plans are adding these to their benefit program for next year, for 2024. It's a wonderful benefit to help reduce and limit the cost of your outpatient prescription drugs. Those are going to come under Part D. And I know in the past, we've always said, no, you don't need Part D because you have wonderful health insurance, which you do. And that's not changing. What the Part D plan is doing is increasing those benefits, giving you some limits on how much you'll spend out of pocket, giving you the Medicare Part D formulary, which might be a little bigger than the one you have in your FEHB plan. So it's very unlikely that you need to opt out of that, because if you're in Part A and or Part B, many of your FEHB plans are automatically going to enroll you. And if you don't want that coverage, you can opt out, but maybe that's something you want to keep. Maybe that's something that's going to be a benefit for you. So check your plan website. It's going to tell you more about that Medicare benefit if your plan is offering it. So check your websites and your plan brochures, but I really think a lot of that information is going to be on the plan website as well. And then the other thing that's causing confusion is many FEHB plans, in fact, all of the fee-for-service plans, with the exception of Blue Cross, is offering an enhanced Medicare Advantage add-on benefit that you can opt into. And these sound wonderful. You get free gym membership, sometimes Silver Sneakers, sometimes another fitness program. You get meal delivery if you come out of the hospital and don't want to cook, and transportation to those physical therapy visits if you can't drive after knee replacement. So all of that sounds wonderful, but these are managed care plans. So you may want to opt in, you may not want that plan, that's okay. You can still stay in your federal health benefit plan as it stands. These are optional programs that you can look into to see if they fit your needs. They can save you some money, so give you a reduction in your Medicare Part B premium. So there is a lot to like, but you may find a little bit more restrictive formularies. You might find a little more restrictions on the hospitals and the providers that you can see. So I think this group that's assembled here today are probably the few that are really excited about open season. Most people dread it, and most people just kind of say, hey, it's too much. It's paralysis by too much analysis, and I'm just going to stay with the plan that I have. But I would recommend, if you do nothing else this open season, look at the front cover of your FEHB plan brochure. It's going to direct you to the rates for next year. Some rates are in fact going down. Some are staying the same. Some are going up. I saw one today that's going up $100 a month. So you want to be aware of that if that's your plan. And you also want to see the changes for 2024. So even if the rates aren't changing, the plan could be changing. So look at those changes. And those again are directed from that front cover. And just see a summary of the benefits of your plan. A lot of people are not utilizing all the benefits that their plan actually has to offer. Did you know some plans cover massage therapy? That might be something you're interested in. And some of the plans do offer that. Foreign Service does the best job on that one, I have to say. But other plans offer some discounts there as well. So there is so much to say, and I think I've used up my time frame, but I want to thank you again for having me, and I hope everybody has a good experience during this open season. Thanks again.
Thanks so much for sharing your expertise and your ways of thinking about these things. Our last expert is Kevin Moss, who has worked for Consumers Checkbook for 25 years, where he leads the production of their guide to health plans for federal employees. He also regularly shares his expertise as a contributor to GovExec, FedSmith, Federal Times, and the Federal News Network, and he holds dozens of webinars throughout the year to provide advice on choosing an FEHB plan. Kevin Moss, turning it over to you.
Thanks, Sarah, and thanks to Congressman Raskin for having this event. It's really important to get this information out to constituents. I'm going to fill in the cracks from the previous two speakers. They both provided some really great information for everyone. I can't emphasize more what Tammy just mentioned about looking at your plan brochure. Even if you're not motivated to switch health plans, your health plan next year is going to be different than your health plan this year. In almost all cases, the premium's going to be different. Some plans, the premium went down. But overall, the trend is higher premiums. This year it was a little bit better than last year on the average enrollee increase. It was 7.7% this year. That was 8.7% last year. Combined, though, these last 2 years are some of the highest premium increases we've seen in FEHB in recent times. But when you look at Section 2 of the plan brochure, it will tell you how your plans changed. It will tell you if there's new benefits. And here's some examples of some of the things that you might find. United Choice Plus Advanced, they're changing their out-of-pocket maximum from $3,000 to $6,000 self-only, $6,000 to $12,000 self+1 and self and family. That's a big change in your out-of-pocket maximum. That may change your calculus in terms of whether that plan is the right plan for you. There's also new benefits that are offered every year by FEHB plans. MHBP plans are offering enhanced maternity programs next year. SAMBA plans are offering doula coverage. Blue Cross plans are offering both marital and family counseling and medically necessary genetic testing. But by far, the biggest benefit that's change that's happening to mostly active federal employees is improved fertility coverage. Now, this has been something that has come up quite a bit. There's actually been congressional interest in this subject. And OPM earlier this year issued a mandate that all FEHB plans must cover artificial insemination procedures. They also must cover the fertility drugs associated with those procedures and IVF. So one thing that you'll see is if your plan didn't previously provide coverage for that, you will see that as a new benefit for 2024. Previously, fertility coverage was largely driven by where you lived in the country, and HMO plans were typically doing a better job covering based upon certain state laws that were being passed. For example, in the state of Hawaii, HMSA and Kaiser have traditionally provided coverage of IVF, but generally there hasn't been a lot of great IVF coverage amongst national PPO plans. So OPM also asked FEHB plans to go above and beyond just the artificial insemination procedures and fertility drugs. And one plan that needs highlighted here that is offering much more than they've ever offered, Blue Cross Standard, now has a $25,000 annual maximum for assisted reproductive services. So this is a new benefit. The artificial insemination procedures and the fertility drugs don't count to that $25,000 maximum. So if enhanced infertility coverage is something that you're looking for, I would definitely take a look at Blue Cross Standard, but do keep in mind that Blue Cross Standard has the highest premium of any national PPO plan. I want to echo Jay's recommendation of the flexible spending account program. Federal employees and annuitants are going to be paying higher premiums next year. Only active employees can use the flexible spending account. So this is really a benefit that's only available to you while you're an active employee. Only about 1 in 5 federal employees have one of these, and that number should be 5 out of 5. This is a no-brainer way to save money. All of us have some level of out-of-pocket healthcare expenses when we think about dental, vision, other anticipated healthcare costs, including over-the-counter items, which are now eligible health expenses for the FSA. There is the use or lose principle, so you do have to budget wisely. But go to FSA Feds to learn more. This is something you definitely should do. And then you also should take a look at another tax advantage program available to you. This are high deductible health plans with the HSA, Health Savings Account. The contribution limits for HSA are going up next year. $4,150 for self-only, $8,300 self+1, self and family. HSAs and high deductible plans, they tend to have lower premiums than many popular PPO plans. And this is a way, if your situation allows for you, to put some money in to help pay for out-of-pocket healthcare expenses today and tomorrow. And one way to really think about the HSA, it's almost like a retirement account with extra privileges, because when you turn 65, you can use your HSA for non-qualified medical expenses. You only have to pay your normal taxes if you decide to do so. In many ways, that then becomes an IRA. So take a look at that, high deductible health plans. On the retiree side, yes, the PDP plans, these are generally really good programs. In order to pass muster from OPM, they have to provide as good or better prescription drug coverage than what's available from your FEHB plan at no additional premium. However, if you are a high income annuitant, you will be subject to the Part D IRMA. So take that into consideration. If you do not want the PDP plan, and almost every federal annuitant should want it, you can contact the plan to disenroll. The plan should have notified you of whether the plan that you're in has a PDP next year. And some of the PDP plans have brought a $2,000 out-of-pocket prescription drug maximum for 2024, 1 year earlier than the IRA or the Inflation Reduction Act legislation calls for. So Blue Cross Standard, all MHBP plans, rural carrier, foreign service, and all Aetna plans have the $2,000 out-of-pocket prescription drug max. So if you have moderate to high prescription drug costs, being in one of those plans could save you some considerable amount of money. And last, the biggest reason to want to enroll in Medicare Part B is to gain eligibility to enroll in an FEHB Medicare Advantage plan. The Medicare Advantage plan is going to package Medicare A and B along with Part D prescription drugs. When we look at these plans, they will save annuitants a considerable amount of money. In our modeling, a couple that lives in the DC area that's not subject to IRMA could save over $8,000 switching from Blue Cross Standard to United Choice Primary Retiree Advantage next year. The savings are so large, you absolutely have to consider them. They may not be the right plan for everyone. You will be subject to both Part B and Part D IRMA if you're a high-income enrollee. So the financial benefit of having a Medicare Advantage plan will be eroded some if you're in that IRMA status. If you spend a considerable time abroad and need routine overseas care, only the United plans offer routine overseas care coverage, so this plan might not work for you if that's the case. And then I also want to echo Tammy's point that you do need to check providers before joining this plan. Make sure that any current or future providers that you want to see, that you still have access to them. So thank you, Sarah. Thank you, Congressman Raskin. Thanks, Jay, and thanks, Tammy, for being a part of this.
Thank you so much for all of our panelists for sharing their insights and this important information. We really appreciate your time and your guidance for our constituents and any retirees or federal employees who might be watching. We are also sharing some useful websites and phone numbers that might help through the process. So for information on open season and FEHB plans, I believe Jay mentioned OPM's tool at www.opm.gov/healthcare-insurance/open-season. Additionally, for help with Medicare, you can conduct a plan search at medicare.gov/find-a-plan. And the State Health Insurance Assistance Program, or SHIP, can provide free information and counseling for Medicare, Medigap, prescription drugs, and programs for individuals with limited income. In Montgomery County, they can be reached at 301-255-4250. And in Prince George's County, it's 301-265-8471. And lastly, if anyone ever needs help with a federal agency, please don't hesitate to reach out to our district office. Our phone number is 301-354-1000. That's 301-354-1000. Or you can reach us by email at raskin.casework@mail.house.gov. We're always happy to see if we can be of any assistance or provide guidance. So thank you again to all of our panelists, and that concludes our forum.